Welcome back. We're on the radio stations at DoraCountyDailyNews.com, and we welcome back Dr. Levi Arnold from Peninsula Chiropractic Clinic. They're located on Kentucky Street in Sturgeon Bay. Welcome back, Levi.
Thank you.
We were talking about concussions right before the break, and, why is this such an epidemic now?
Oh boy. Well, football is the most popular sport in America. So people like that rough and tough stuff. So when kids are in adolescence, like I said, they're still maturing. So some of their reaction time is not as good as professional athletes, but still professional athletes get concussions. Preventing them, boy, within football, it's hard to say. You can practice the right tackle and do all that stuff, not lead with your head, but when there's an instinct of someone running at you or getting blindsided by somebody, the only way of preventing it is playing flag football or two-hand touch, And in soccer, they hit the head, they hit the ball with their head. So, those little, micro traumas to the brain every now and then. So it's hard to say what we can do to prevent them educational-wise. I think the NFL and all that other stuff, they're trying to do a good job of making awareness of it. But at the same time, it's all... more of the education needs to come of what can you do when you get one. I know a lot of PTs and doctors out there, once they get it, they go through a certain module of all right, make sure you can do this without getting a headache, make sure you can do this without losing eyesight, not seeing double. And I think that's a good thing. But again, there's a missing aspect. Being a chiropractor, I'm always biased to chiropractic care. When we adjust somebody, more blood will go to their brain, which can be lacking because you have a brain injury. Alright, I don't know if you've ever seen slow motion video of people getting a concussion or a brain actually hitting the skull. Depends how you get hit. Sometimes the front of the brain can get hit, which is short-term memory, emotional. Sometimes it could be the back of the brain, so more tension headaches, problems with your eyesight. Sitting and resting only can do so much. Just like when you're working out, you can't just sit there and look at a weight, you're not going to get big.
Mm-hmm.
So if you have a neurological glitch or a concussion, sitting there and avoiding things of steadying and all that stuff, you are actually missing out on something. So what chiropractic adjustments do, when you adjust the neck, more blood goes to your brain, you stimulate that nervous system to get back to what it used to be. So we call that retracing. So again, you're not going to become Einstein. So if you're not going to gain, a different knowledge, but you're getting back to what you need to get back. So the rest part is great, but there's still stuff lacking. I'm always biased to chiropractic care, and I don't see that being incorporated in schools. I don't see that being incorporated in NFL. I know that most NFL teams have a chiropractor, but only 30% of teams use their chiropractor.